with a youth athlete, you have another person involved, and that's not normal with typical with an adult, and that's the parent. And that parent is really the driver. They are the chef. Hi, everyone. Welcome to the podcast. Welcome, all new listeners, and welcome back to those who have heard my content in the past. This is a phenomenal podcast. I love youth injuries. I love managing youth athletes, just the relationships and everything that goes along with it. Before I start talking about this podcast, let me give you some life updates. If you've been following my podcast, you know that it has been a crazy time in life, to say the least. We officially launched our second location of sports performance physical therapy, and the soft opening was last weekend. And man, am I rested? Um, yes, reinvigorated. The last 38 days, it took us from start to finish, I think 28 days to open, and it was just a very intense time. It actually reminded me of when I was in residency, and just you're putting in 80 hours, and it becomes a standard, and you're just like, it's kind of like riding a bike. You're just used to the no sleep and everything else. So that's done, and it's the beginning of something new. So for me, it's just it's amazing to just grow with life and seeing what's coming at it. And this new location is very exciting for us. Other than that, my kids are doing great. My son Jacob just rolled over at 5.5 months. He just rolled over for the first time. So we are about, we are about to get a kickstart into reality of parenting because he no longer wants to just lay on his back. He's here to move. So, all right, on to the podcast. Speaking of youth and little kids, let's talk about youth injuries. Now, why did I create this podcast topic? Well, everything is based off of what's happening and coming at me throughout life and that week. And I had a team member ask, hey, what would you do in this scenario? And we talked about it. And they had asked, is this the right way I should be approaching this parent and athlete? And I was like, I explained the situation. I think that this is where I would have gone. And then afterwards they said, it didn't seem like they felt comfortable with where they ended up going, and they needed some help and support. And after talking through the case, I was like, I think that there's a lot of PTs who would benefit from this, because I think we all go through this, and I'll explain more as we go on. But I think this is really going to help you with your clinical approach to people and who you serve. This podcast is not going to be about managing specific bone injuries or unique injuries just to youth athletes. I'm talking about managing youth athlete injuries, not specific injuries. I'm just saying in general. I think that we have all taken CEU courses or online courses or read books or articles on specific injuries for athletes, whether that's bony or ligamentous or whatever it is. I'm talking about how to manage an athlete that is underage, and you're kind of co-managing with several people in the equation, and that's what I want to review. So the case that I'm talking about is a youth gymnast, and the athlete has a mild injury, but what becomes a challenge is actually trying to navigate return to sport in a very short timeline. And I think it was within 2 weeks after a mild ankle injury. And so when you are trying to manage a short timeline and you're seeing them 1 to 2 times a week, there's a lot that needs to happen in order for that athlete to get back to sport or competition. So if this person was going to try and get back to sport within 2 weeks, if we always work backwards. So if we look at 2 weeks, 2 to 3 days to heal, just kind of acute injury management. You probably have 3 to 4 days of range of motion, some balance work, and you got 3 to 4 days of actual strengthening, and then you have integration into plyos, and then right back into practice. And that's assuming they can get at least a couple days of practice, depending on how elite they are and the level of competition, and then to be able to compete. That's a very short timeline. So when we put it in context, the athlete wanted to go back to sport, and they're asking, what percent or how much can I do at practice? And the question became, that's really hard to quantify in gymnastics world. Like, are we going 50% intensity? Do we talk about reps? And so I wanted to share, there's two ways that I will help support somebody getting back to sport. Uh, Absolute intensity or percent or relative. So there's two main ways to look at this. If you look at relative percent of intensity or strength or whatever it is going back in, you're talking about, hey, in the game, in a soccer game or gymnastics, you're only doing 50% intensity, 25% intensity, 75% intensity. And if you're talking about absolute numbers, then you're saying, hey, only 10 minutes of the game, or only 42 minutes of the game, or only two repetitions of a back handspring and you're done. No more than that. Now, when would you use one more than the other? And I think that that really depends on the person, and that's why you need to be able to pull different tools out at different times. So for this athlete, sometimes when you look at an athlete or a client or a patient, you see them and you're talking to them and you're like, hey, this is what I recommend. And they're just looking right through you. They're like, I don't understand what you're talking about. And you're like, okay, well, let me break this down differently. So this is how this works. So a lot of times I'll go in with a percent. I'll say, hey, athlete A, you have a game this weekend. You're allowed to play 50%, full contact, 50%. And they just like look right through you. I'm like, oh, okay, sorry. You can only play 15 minutes of the first half and 15 minutes of the second half. That's it. And they're like, oh, I get it. Some people or some sports might be more inclined to use percent or absolute numbers versus relative numbers. So it just really depends on how they view it. And if they just don't understand, you're going to have to switch it up. But I think you need to be prepared to have both, because they can see you stumble and you're like, you don't have another option for them. They're just like, I don't understand what you're saying. And then you see it. They're like, oh yeah, okay, I get it. And I think when you do that, it's very, very obvious. And you just need to have a backup. So I think when your communication style has to change is when that person doesn't get it. Now, there's a couple other scenarios where it has to change as well. Now, with youth athletes, it's very different in the sense that you're now managing a person, which is no different than everybody else. However, you're managing a person who is under the direct supervision of multiple people. And now, in professional setting, you might have multiple clinicians working on the same person, and now we're all responsible for that person. But this person now is a minor. And the main person, and anytime that you're managing somebody, you need to know who the main chef is, the main cook, the main person managing this person. So at different stages of rehab or injury, we will be the primary person on this. If it's a post-surgical, person or an athlete, then it might be the surgeon during a certain timeline saying, hey, you know what, still don't be aggressive, back off of that, don't go to full range yet. I know I put tighter anchors. I did different things in there. Please don't do it. So they're the primary chef. They're the primary cook. So you have to know from a professional standpoint who's leading charge, who's leading the way. However, with a youth athlete, you have another person involved, and that's not normal with typical with an adult, and that's the parent. And that parent is really the driver. They are the chef on the other side. They're looking out for their child's well-being. And that's the way you have to see it. Not that you're hoping it's for well-being, but you also have to hope that they're there to make sure that they're safe and everything else. But they're also looking at, is this person going to start? How important is this game coming up? And so when I'm communicating, there's a couple tips I want you to take away from this podcast, and this is one of them. The way you communicate is going to be different based on who the driver of the relationship is. So when you're talking to a parent, we're talking about an athlete. The parent is typically the driver on that. Now, the challenge becomes the difference with a youth athlete session is that typically, not on the initial evaluation, but on follow-ups, it's going to be the parent who drops them off, or the athlete probably drives by themselves and maybe the parent shows up afterwards. Or if they drove them, you're only going to get them on the first 10% of the session. The parent says, hey, here's how they did in practice. Here's how they're doing. I'm going to be outside, or I'm going to run the store. I'll be back. And then they're gone 80% of the session, and then they come back for the last 10%. So everything that you tell that athlete is going to be relevant unless that parent knows on the front end and the back end of that session of what your expectations are and what your plan of care and what their progress is, how they're doing, what you expect, so that everybody's on the same page. Because at the center of the circle is an athlete as a patient, and everybody else around is there to support, meaning the parent, the coach, the PT, the physician, the dietitian, whatever it is. Everybody's around that athlete. So in normal circumstances, if you're talking about an adult, they get to make that decision, and they're gonna communicate with everybody else. But in the sense of a youth athlete, the parent and the athlete are at the center of that, and they need to know everything that's going on. Because if you've talked to, like, 15 or 14-year-old or 17-year-old, sometimes just things go right over the head. Like, you just spoke about it 2 minutes ago, and they're like, I don't remember. Uh, how'd you like the session? Was it great? I don't know. What'd you guys do? I don't know. So, and that's going to be relayed to the parent. And so the parent's like, well, why am I bringing this person twice a week to do nothing? And in reality, you put them through a great session. They're sweaty. They had a good workout that was productive. Their knee is feeling better, but they just couldn't communicate to the parent. So you need to be the that moderator, that mediator. You need to be able to communicate that, or else there's always going to be a question of what you're doing. So I think you have to, one, be mindful of who the driver of the relationship, who is the adult, who is the person making the decisions, and that is the parent. Yes, the athlete can make their decisions because they're maybe getting closer to 18 years old, or they can drive, but that still doesn't make them the primary on the decision making, because it's about the safety of the athlete, because all those fingers will come back to you. Well, why didn't you do this? How didn't you do that? So I'm very particular, and also I always have to think about it. If I'm a parent, I want to know what's going on. So I would really appreciate if that provider told me and what my input was, even though my son or daughter is, so and so 18 years old or 17 years old and they're driving on their own. I still need to be aware of these things, because ultimately it's their responsibility. I'm the parent. So communication style. Number two, you have to be aware. Not only is that parent the main person that needs to understand everything, and you need to be communicating that on the 10%, on the front 10% of the session and the back 10% of the session, so that way it's all good. The other part is you have to be communicating with their technical coach or the skill coach, or if they're a soccer coach, great. Basketball coach, great. If they're working with their personal trainer, great. There's multiple people in this circle, and you cannot rely on that youth athlete to communicate that, because they can barely communicate to you. If you do and rely on that, you're not going to be successful, and you will not get referrals to you. You won't get other people coming back to you, because ultimately there's a few people who need to be satisfied and make sure that this person's safe and doing well. And you know what that is? Ultimately, did they return to sport in a timely fashion and safely? And the people who are going to determine that are internally us, the providers. However, externally, the coach. They didn't get to go back to play, or they were only 50%. I didn't get to play them. The PT never told me what I can do, so I just held them out. So, and the other person is the parent, who's going to tell other parents, hey, that PT's amazing. They told me every single time what I was doing, what I couldn't do, the progress on that, and they even called the coach and they told him or her what needs to happen. I mean, that's an ideal scenario where you have somebody who can just mediate between all these people. You're that central piece. So that athlete is there, but you're just helping support what needs to happen. So number one, make sure that you're communicating with a parent. Number two, you have to integrate everybody. I don't care who it is, you have to integrate them. And if you're just relying on yourself and you told the parent, you told the athlete, there's going to be a lot of miscommunication. And we all know when you say one word or a few sentences to somebody, that just changes it as they continue to talk to other people using that same language. So, parent and everybody involved in that circle. I think it's critical, because you leave it up to that athlete, you're going to be in significant trouble. So the difference between youth and adult sessions is that ultimately the adult would be the primary person to communicate that. Now the youth athlete won't communicate that, so you have to be in that inner circle and spread that word. And know who your decision maker is. The decision maker is typically the parent, who's ever bringing them, to and from. I make it a big point to my team to walk out to the car, tell the parent how they're doing, and also make sure that you're calling or following up with emails so both parents or whoever it is just knows, and that there is documentation that you're supporting a plan of care. Or if they're having flare-ups and you're not recommending and they want to push a little bit more, you have to have that support. And I think that's it, and you can put the athlete on there, the coach, the parent, and that way you're saying, here's my framework, and then they can sort out how much they want to push and pull against you. But ultimately, you're providing a sound plan of care based on your knowledge and everything that you're seeing per session, and you're just providing updates. So know the difference between youth and adult sessions. Know your decision makers. Be sure to have a team approach to who you see, the parent, the athlete, the coach, and then make sure that's in verbal and written form. Now, communication. This is a big one. Just the style of communication. All right. A lot of us go to school for a long period of time. You earn all this education. You take a lot of exams. And when you exit PT school, become licensed and you enter the world and you're practicing, you're doing all these things, ultimately you want to make sure that you're letting people know, like what your skill set is, and you're trying to provide the most amount of education and support people through their fitness and movement and health journeys. And sometimes we forget what it feels like to be on the opposite end of jargon. So if you went to maybe a surgeon, neurosurgeon or whatever, and they're using terms that, like, I don't even know what that is. I don't know what it does. And what I mean by this is you have to remember to simplify your communication so much that your parents or even your grandparents would be able to understand that. So the posterior lateral corner of the knee, when it goes into extension, is providing irritation and trauma. So every time that they go into terminal knee extension or they stride above 75% with both linear and lateral, that's when they're getting their symptoms, and that's what's causing the flare up, and that's what's causing irritation on the posterior lateral corner of the meniscus. And family members like, I don't know what that means, and simplify that, like, oh, the back of the knee hurts every time they straighten it. Yeah, so we're not going to hold on. We're going to hold on sprinting and jumping, because every time they do that, you have to straighten your knee. So we're going to hold off on that. See the simplicity of that, and both a parent and a grandparent should easily understand that. Oh, just don't allow them to straighten the knee. Makes sense. Perfect. Or explosive movements. Those type of cues and simple communication is key, but you forget what that feels like because you're in it all day, every single day. And the minute that I see a parent kind of just like stare at me, maybe do a little squint, like, I don't know what you're talking about, like, oh man, I messed up, that's my fault, let me backtrack a little bit, and I'll call them out and just say, like, what did you take away from that, or what is your understanding of what I just said right now? That way I can just, like, at some point they just start like mumbling, and they're like, and you can tell, I'm like, I'm so sorry, can I help with just simplifying that a little bit, because I'm so sorry I was confused here, or confusing. Here it is. I don't want them straightening their knee with explosive movements, so like no jumping and no sprinting for the next week. And they're like, oh, why didn't you just say that before? I'm so sorry. So keep it simple. Your communication style has to keep it simple. Why? Because there can be no ambiguity between the coach, the athlete, and the parent and you. Zero ambiguity. And when you use jargon, 3 out of the 4 don't understand what you're talking about. The parent, the coach, and the athlete don't understand. Those are the most important. So you have to use terms that all 4 of you guys can integrate and make sure that you're on the right track. So your terms have to be so simple that everybody is on that same page. So number 1, know the difference between youth and adult sessions. Number 2, know who the decision makers are. Number 3, you have to have a team approach. Number 4, your communication style should be simple and straightforward. So keep it simple. Anyway, the KISS principle. All right. The other 2 components that I think that is very, very critical, and it came off the discussion that we had with the team member, is that when we talked about the parent, when a parent comes to a session, and there might be different for different people, and different even post-COVID or in COVID or whatever it is. Some parents may not enter the facility. They just might be out in the car doing whatever it is. And so I make it a point on the first 10% and the last 10% of the session to communicate with that parent on an update on their plan of care. So what I mean by that is, what happened, what needs to happen, and what do we say was going to happen. And let's just talk about updates on that. And then you go through the session. Maybe might not be present. They're on their phone, they're doing whatever. The middle 80%, do your thing. That's what you're really good at. Finish it. Do your job. Perfect. On the last 10%, that's where you have to go back to your communication skills, make sure everybody's on the same page. So, what was the plan of care? What went right? What didn't? And what do we need to do moving forward? When you do those three things, both the start and the finish, and it's simple communication, and you include everybody on that communication, guess what? Everybody knows we're a green light, we're a yellow light, we're a red light, and what we need to do to make sure that we're back on the right path or stay on that same path. And when you do that, I know it sounds really fundamental, but when you do this so effortlessly and fluid, athletes are like, I love working with this person. Parents are like, I love working with this person. The coaches, I'm going to send all my athletes there. And that's how you build credibility within the sports world between athletes, is because you make it so simple that they don't even know how much work goes on behind that. And you're like, it looks so simple. You're like, I just painted the Mona Lisa real quick. It was just so easy for me. But how much time and effort went into planning that? So number one, the last 2 points were: one, that you need to make sure that the plan of care and everything, your updates, everything else is addressed early on in the first 10% of the session and at the end of the session. So that way the coach, the parent, and the athlete and you know, here's what the green lights are, yellow lights and red lights. Here's what we're not doing. Here's what you got. I'll see you on Thursday. And this is a plan. From there, we'll review all over again at the beginning and at the end based on the session. The last point goes along with all of that. If you haven't heard my podcast, my recent podcast on plan A, B, and C, triaging and planning for worst case scenario or best case scenario and having different options. This is where underlying the entire session, this is assuming you've done this. Because if you're going to talk about a plan of care and what's gone right and wrong and what we need to do about it, if you don't have options for what just happened and went wrong, and now you have to do something different and you don't have a plan, you're going to look really bad. And they're going to tell that you don't have that confidence because you're doing the blank stare that they would have had. So you need to have a plan A, B, and C at every single session. Youth athletes are so unique in that they heal so fast. And sometimes, getting information from them is it's like pulling teeth. You've had those sessions where you're like, "How was your day? How was school? What'd you do today? What'd you eat? Who'd you hang out with?" And they're just like, "Fine, fine, 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 fine." Great. You just have to have different options to entertain them, to push them, to motivate them, to get them to talk, and then they need to be able to communicate their symptoms. And you're like, "Hey, is that easy? Is that hard? Are you having pain?" No, no, nope, nope, nope. And you got to be able to piece that out and pull it out from every single athlete. So you have to have a plan A, B, and C. If this doesn't go right, what's going to happen? And then you got to be able to adjust that and have a conversation with the parent afterwards. Hey, they flared up a little bit. We were planning on them playing this weekend. I understand that we thought they were going to, but we also had a backup plan. If they didn't, we were going to hold them and then be ready to go for next Tuesday. I know it's not ideal, but this is a plan moving forward. On Saturday, they're going to do this. Sunday, they're going to do this. Monday, they're going to do this. They're going to see me on Tuesday, and then we'll have them 90% ready for the following week. And when you come in like that confident and you have a plan, the parents are less resistant to take your advice. So you definitely have to have that plan A, B, and C ready. And if you don't, you're going to look bad. Now, in between all these points that I gave you, you have to have the clinical skill set to be able to manage that athlete. And I think that if you've listened to my podcast enough, you understand that I'll give you those, and we'll create some seminars and everything else to give you those things. But ultimately, your framework has to be sound, or else you're just going to lose that athlete. And that's what we talked about with this team member, that if you didn't have plan A, B, and C, you didn't talk to the parent at the beginning, at the end, you didn't use a cohesive communication style, you didn't keep it simple, you used a lot of jargon, guess what? The athlete, whatever you did during that 80% was irrelevant. Because the parent didn't understand, the athlete didn't have a good time, nobody knows, and they just think that you're an average PT. Yeah, that's tough. That's a dagger to the heart, because you're like, I went to school to do the 80%, but the reality is you got to create the framework, the communication, so that way they appreciate what you do for them. But they can't appreciate it until you make it simple. And that's the hardest part for PT students, for new grads, for veterans who've been doing this a long time. I've met a lot of people who still struggle with this. You guys have the great clinical skill set, the middle 80%. It's like you guys got the meat of the burger, but the buns, the 10% and the 10%, you just don't have it. You got to be able to sandwich a whole session, and that is really what you need. So I wanted to share this because it was a straightforward, easy case, and after having a discussion with this team member, they're like, "I get it. I messed up. I messed up. I got to get myself out of a hole because the parent was still confused." And the reality is they were. And I think you have to admit that. And then now what? Fix it. Now call the parent, email, let them know, include the coach on it, include the athlete. Here's the simplicity of it. Here's what we're doing. And I think that that's why a lot of us are better at creating like written programs or emails. Why? Because it allows you to think and you have to create an outline and backups for what you're about to say. And sometimes when you're in front of them, you don't have that time to reflect and consider like, is this sound? Am I missing anything? And that's why your verbal confirmation, your verbal skill set is going to be a little bit more challenging to develop because you don't have that time. And that's why I'm telling you, you have to have those plans behind the scenes to make sure that when they're in, you've thought of everything and you're ready to just hit send during that session. That's ultimately what you're doing in the session. You're just hitting send that last little bit. So I hope that helps. Ultimately, managing youth athletes is very different than an adult, and it's only because you are managing multiple people, not just one. When you are managing that ankle, you're at least managing three different people: the athlete, the coach, and the parent. And that's a big deal. It's a different way to manage them, and you can't treat them like an adult. You do. You won't have those people coming back to you. You won't have referrals. You won't have anybody vouching for you, and that's ultimately what we want. I think that creates happiness and fulfillment in each and every one of us when people are like, "I want to go see Chris. Like I've heard great things." And you're like internally, that just it rewards you for everything that you've put in. And if you're looking for that, these little nuances are what you need to take you to that next step into developing that. So I hope that helps, whether you're a new grad, a veteran, anybody else. So I'm going to put this out again. This is a general update. I've thought about this, and now that we've launched the second location, I'm really, really excited about the next step for us. So for the next year, my vision and goal, I was talking to a team member today, vision and goal is to put on a couple seminars next year. And I want to do it a little differently, and I'll announce more. But I just need to get some support and feedback from each and every one of you. Now, I don't care where you're listening from, but I think ultimately I'm looking at developing some courses that might be a little different from the norm, in the sense that they might have different topics that may not typically be covered by standard CEU courses, and I'm looking at just making them a day so people can drive in from. I know we have a lot of people listening from San Francisco, from LA, a lot from Washington. I don't know who's out there, but I appreciate you guys. But I'm looking at developing some courses, both sports, taping, clinical skill set, leadership development, personal development, and I just need to get your feedback on what you want to be able to learn. So if you're interested in learning anything, I'd love for you to just send me an email, drchris@drchrisgarcia.com. And I'm thinking March, April, May of next year of 2022. Wow, that's scary. To be able to host these things and here in San Diego, and probably at our new location in San Diego. It's right next to the airport, and we have easy access. So we're looking at doing that. But I just want to get a feel for what you guys are interested in. And if you're not ready to tell me, what you can do is just opt into my mailing list, and you just follow along into updates about what I'm going to do, because that's probably where I'm going to release them. So I think it's drchrisgarcia.com/mailing-list, and opt into that, and then just follow along. I'll keep you guys updated. I hope you guys are doing well. I hope that the holidays were great. It was Thanksgiving yesterday, and just feeling nice and full and rejuvenated. Rejuvenated, that's the word I wanted. But yeah, I will catch you guys on the next episode, and I hope you guys are doing well, and I will see you then. Bye, guys.